Thank you.
In the health sector, county governments have key functions which include planning of the health of each and every county or health sector of each and every county. County governments have a function on budgeting because that was the constitution of the Republic of Kenya says. County government work on a function here, human resource, to ensure nurses, doctors, clinical officers, and other people who are working in hospitals are well taken care of. There are resources to ensure that human resource within the health sector, in our county government, in our hospitals across the country, that role, that function is squarely under the county government. Also budgeting, as well as provision of emergency medicines, and also provision of medical supplies. Unaona madaktari wako nyumbani, madaktari wanagoma. Kwa nini madaktari wanagoma? Madaktari wanagoma katika nchi yetu ya Kenya because most of the county government in the Republic of Kenya are not taking seriously these key functions which they have been given by the Constitution of the Republic of Kenya. Na zile county ambazo zinafanya ama magavana wanafanya kazi sawa, we don't have that challenge. And we have quite a few of them. We are calling upon all the county government, all the governors of the Republic of Kenya, the Council of Governors, which is chaired by Governor Waiguru. Please, let the governors put their act in order so that we can see doctors, nurses, clinical officers performing what they are supposed to be performing in our dispensaries, in our hospitals, level 4, level 5, across the nation of the Republic of Kenya.